Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
This is KRWG Public Media, TV, radio, online, news that matters. Now, across the Mesilla Valley and the borderland, the stories that shape our community. From the KRWG Broadcast Center at New Mexico State University, this is Newsmakers.
Hello and welcome to Newsmakers. I'm Anthony Moreno. On the program today, we learn more about research that tries to understand the long-term health impact of food insecurity for those living with chronic diseases. But first, we turn our focus to vulnerable road users. According to the Centers for Disease Control, thousands of pedestrians, bicyclists, and motorcyclists die every year on the roads in the United States. Our featured guest on the program today is working to address this issue in New Mexico. Please welcome Barbara Toth with Vulnerable Road Users New Mexico. Barbara, thank you so much for joining us.
Thank you, Anthony. I'm thrilled to be here.
For those who might not be aware of your organization, can you share a little bit about your mission?
I can, yes. We formed at the very beginning of 2022. So we are now closing in on the end of our third year as an organization. We are advocates, loud and clear, for safety for all who use our roads, in particular vulnerable road users legally, our bicyclists, pedestrians, runners, those who are not safely enclosed inside of a vehicle. And so we advocate on a local level. We're beginning to get a little bit of a voice broader than that.
Now, this is advocating for a lot of folks who are using the roads. Yes. According to the New Mexico Department of Transportation, I believe it's 30% of New Mexicans are vulnerable road users.
Yes.
So can you share with us a little bit about the reasoning for establishing this organization? I know it's a personal reason to you.
You know, it is a very personal reason. Anthony, my husband has been a bicyclist for over 50 years. And in theory, I always knew he was at risk. His friends were at risk. I was always grateful he made it home safely, and he had some pretty scary stories along the way. But we never experienced up close and personal.
Yeah.
Until March 20th, 2020. The phone rang. It was not the husband, it was the policeman, saying, please go to Mountain View right away. Wasn't able to give me any further information. My husband had been hit while on his bicycle by a 17-year-old driving a truck. He was very seriously injured. In fact, so serious that he had to be flown to El Paso. He probably would be in a wheelchair had we not had such a wonderful neurosurgeon, and he was prioritized in his care. But he lives every day with those things. He has spinal cord injury. He has traumatic brain injury. Thankfully, he can still ride his bike, which is wonderful for him. But we became aware in the most frightening way you can imagine how real this danger is. And why I talk to people who say, no, I won't let my children ride their bikes. No, we're not going to ride to the park as a family, because people are terrified. And I think in many ways they are right to be.
I'm so sorry to learn about that. Now your husband is doing much better. You mentioned he's able to ride a bike again.
He is, not nearly like he did before, but he certainly can. And he is so much better. I'm grateful for that.
Well, can you share with us a little bit about the prevention and education work that you're doing in the community to help prevent accidents like that from happening? And I should also want to talk about, I said accidents.
Yes.
You're also working on how we describe these crashes that happen in New Mexico.
Maybe I should start with that. The semantics really have a built-in perception. Whether we mean accidents or it's what we've just been accustomed to saying, an accident by its very nature means it could not have been prevented. The reality is most of these crashes could have been. So we do encourage people to think and to speak. Crashes, collisions, even something incident which does not label as accidental. Someone spoke with me recently and said, you know, what else is it besides an accident? And I said, sir, when I sat beside the hospital bed of a husband that I didn't know if he'd live through the night, I realized there are any number of things that could have saved him. It's not an accident.
There's so many reasons why these crashes may happen. Can you kind of share some of the top reasons why we have so many of these incidents?
Yes. One of the very worst is distracted driving. It is also, quite honestly, one of the ones that were not got very well quantified. There are other things, speed, road design, some of those other things. But distracted driving is what has really stuck with me for a couple reasons. The young man didn't know my husband was there.
I see.
He was not cited or even investigated as to perhaps there had been phone use. But because he was 17, most likely involved in distracted driving, and as a lifelong educator, it broke my heart to think of a 17-year-old truly having been responsible for something like that. How much worse would if my husband hadn't survived, to know that you had killed someone? So I've been going into the driver's education classes here at Las Cruces Public Schools, and I speak to the young people there. They are ready to drive, but they don't have bad habits yet. They're ready to hear how that changed my life, how it changed other people's life. And we can talk about a few statistics, they're fine, but they sit up and they won't take their eyes off of me when I show them the picture of my husband. They understand when I point out to them. We all have responsibility, regardless of who you are, where you're driving, what kind of transportation you're doing. We've got to look out for one another's safety.
Do you feel that the awareness of pedestrians and people who may be on bicycles or motorcycles is improving, or do you feel like there's still a major challenge with this at the local government and state government level?
I think there is going to be a challenge for a long time on many levels. One of them is that this is a very polarizing topic. You can't talk about it sitting across from someone without someone saying, you know, bicyclists don't pay taxes or this, that, and the other. So it's very polarizing. Therefore, everyone's very defensive. Everyone is probably a bit broad, but it comes across as something that a lot of people are really willing to argue about. And so because of that, sides begin to be taken. And that's harmful. That's harmful on our city level. It's harmful on a bigger picture. But what I am finding in this community is still hometown USA. We know people by name. We recognize hearing them on the radio. We know one another through friends of friends. And that's part of what I'm doing out here. Not only my husband, even more so for those who did not survive. If we think in terms of numbers, it's only momentarily upsetting. If I assign a face and a story to every one of those numbers, people are starting to get it. I have people say to me, close friends, people who I would have thought were most responsible people, saying, I'm ashamed to admit that I did this and this and this. These are the habits that I've changed based upon your story.
Storytelling can be very powerful,
Yes.
and especially when we share those personal stories
Yes.
on how folks are impacted. Also awareness, for somebody who may be used to driving a car or a vehicle all the time, and then all of a sudden they have to move to change their habits for
Yes.
whatever reason. It could be economically, it could just be for health reasons. They may ride a bicycle or walk or use public transportation where they are those vulnerable users. Is this
Yes.
something that you really see people paying attention to once it really affects them personally?
Once it's drawn to their attention and affects them personally, undoubtedly. It also gives a position from which to answer some of the naysayers. For instance, the person who said, that's fine if your husband wants to go to the grocery store on his bicycle, but he shouldn't be on the roads that the cars are using. Well, reality, folks, and you maybe didn't realize this, we don't have connected bike paths that get there. So I do find people by and large do not want to be polarized. They don't want to be angry and blaming and shaming, but sometimes they have to hear it with a name and a face. And then they begin to honor that understanding.
This is a major challenge in New Mexico. The state has ranked very high, according to the Department of Transportation in New Mexico, #1 in the country in pedestrian fatalities. New Mexico, it has over twice the fatality rate for pedestrians per 100,000 people than the national average. Those are striking numbers for a lot of folks. Do you think this is getting the attention of lawmakers in Santa Fe who may be able to make the difference with this?
I should perhaps tell you it's getting the picture beyond that. I had the great privilege of being on the Hill in DC in May. And sadly, these things in the state of New Mexico that put us at the top of some of these lists they're not usually things to be proud of. But to be able to sit with legislators from other states and say, my senator, given the statistics in my state, which is in desperate trouble, my senator is bringing forward some of this legislation. And I think that New Mexico is going to start taking maybe not a leadership role yet, but a more active role, and to begin to really demonstrate that we can turn it around.
One of the things that has happened in the state is at the University of New Mexico, there has been a dedicated research center to look at this issue and use technology to better understand how we can prevent these crashes. Can you share a little bit about that?
I can. We're very fortunate to have that here in New Mexico. There are only 5 across the country, and actually UNM was chosen because our statistics have been so high. But the people there are, by and large, academics and researchers. So they are putting the wheels under these concerns. It's one thing to say people are not safe. It's another thing to give the statistics. They're very highly regarded, by the way. All of the media outlets across the country are really listening to what these folks say. We're very fortunate to have them in our state.
What are your hopes with this center and how it can really make a difference with this issue?
One of the things I'm especially hoping for is academics and researchers don't always know what those of us in public need to know. A big one for me, which I tell our story to researchers, is 407 people lost their lives in our state last year. We do not know how many survived. 5 times that many? 10 times that many? So it's helpful to tell them what we need in order to be persuasive. And I think it has cast a spotlight on this state. They're investing. That center, perhaps you know, is nationally funded. And so the national hierarchy, Department of Transportation, is recognizing that we're a good place to get the foot in the door and really begin to make some change.
Well, we'll certainly be interested in learning more about the research that comes out of the center. And there's also more awareness issues, events coming up. World Day of Remembrance for Road Traffic Victims is coming up soon. Can you share with us about how our region is going to be spreading awareness locally?
Thank you, I'd be delighted to. This is a global event, and it will be coming up on the 17th of November. Locally, we have chosen 2 aspects of this event that we're going to do. On the 17th of November, there will be information to find out more about that. We're going to have, at twilight, a candlelight vigil. We're going to honor those in our community and further afield who have lost their lives. We believe those were senseless deaths that should have been prevented, and we're going to honor them. But we're not going to gather just to say how sad we are. We're going to honor them through action and make some plans. We're going to precede that event with a bike ride run. And it's kind of a great way, those are the most vulnerable people, for them to gather and show solidarity And it's an important way for others in our community to see them get the impact of how many in our community fall within the need of being more safe.
Now, folks can learn more about this event and awareness also at your website,
Yes,
is that correct?
it's vrunm.org.
Okay. Now, some communities in New Mexico have taken steps to address this issue.
Yes.
In the city of Albuquerque, they've adopted the Vision Zero.
Yes.
Can you share a little bit about what that does for communities who are looking to take a step and address this issue that concerns so many?
Wonderful, thank you. We have been urging right here in Las Cruces to take that step, and I do believe we're getting closer. In its simplest form, Vision Zero is a global program that believes we don't have to have 407 people dead in our state. We don't have to have 47. We can work together to get it down to zero. The only city in our state is Albuquerque, and they have seen dramatic improvements.
Now, this is also something that you're trying to get officials at the state to put into the long-term state
Yes.
transportation plan. How do you feel this can really make a difference with that?
I think it dovetails very well. They did put a plan, in fact, using some of the language, it's transportation zero, I think is what they're calling it here in New Mexico, which is very much the same thing. However, by aligning simultaneously with Vision Zero, then we get that generous add-in of communities all over the country, communities all over the world. I was really delighted to see our state take that step. I'd like to see them align with those across the country.
We just have over a minute with you left, but what are some things that you hope lawmakers in Santa Fe can adopt to really address this issue in our state?
I think the biggest thing I see, they have some really good bills in front of them about some things that they can do with infrastructure and with built-in limitations in our vehicles, but they got to do it. They got to follow through on it. And that would be our biggest request. Not only stand for it, but make it happen.
Now, you've been leading this organization for a couple years now. What are your immediate goals coming up in the near future? And what are some goals that you have for this group and that you hope you can accomplish?
Well, I love this area and I love our state. I would like to see us here in southern New Mexico take this idea broader to all these smaller communities around us across the border into El Paso. It's an important issue and its time has come. My personal passion for these young people, we don't have the stats yet, but after I've talked to hundreds and hundreds of them, I bet we're going to see things safer right here in our community. And I'd love to go anywhere in the state of New Mexico and train someone how to do what I'm doing.
Barbara Toth is Executive Director and founder of Vulnerable Road Users New Mexico. Barbara, thank you so much for being with us.
My pleasure. Thank you, Anthony.
Moving on, new research aims to help us understand how food insecurity may be impacting those living with chronic diseases. Scott Brocato has more in our In Focus conversation.
Hello, I'm Scott Brocato, and welcome to In Focus. Our guests are Jagdish Kubchandani and Karen Kopra-Fry, professors of public health sciences in New Mexico State University's College of Health, Education, and Social Transformation. They've recently collaborated on a series of studies to understand the long-term impacts of food insecurity among American adults living with colorectal cancer and chronic kidney diseases. Dr. Kubchandani, Dr. Kopra-Fry, thank you for joining us on In Focus.
Thank you for inviting us.
Well, let's start with you, Dr. Kubchandani. What led the two of you to conduct these studies?
We have our healthcare expenses are rising across the nation. much of it because of chronic diseases. People are losing their lives to chronic diseases. We wanted to know what are the other factors that influence life expectancy in people who have chronic diseases, social things that we could do, social factors. And one major problem is chronic diseases are expensive. On top of that, you need to maintain healthy diet and nutrition, and people are not able to maintain that. So we wanted to know what's the impact of food insecurity, poor diet on chronic diseases.
And Dr. Kopra-Fry, why did you decide to zero in on food insecurity's effect on colorectal cancer and chronic kidney diseases specifically?
You know, it is an important issue. 100 million Americans have at least one major chronic disease. So we're thinking about, as my colleague Dr. Jagdish indicated, you know, the healthcare expenses are on the rise. But colorectal cancer, when we looked at premature mortality or dying sooner than would be expected, you think a disease process, a chronic disease such as chronic kidney disease or colorectal cancer. Some startling figures we found in this study. One of them is that there is a fourfold increase with colorectal cancer and food insecurity. Premature death over just having colorectal cancer alone. So it's suggesting the importance of that other factor called food insecurity with chronic kidney disease in a sample of over 10,000 adults over 50 plus years of age. Again, a double the increased mortality rate when you add food insecurity to the equation of chronic kidney disease. So I started digging a little deeper. That's off of the National Health and Nutrition Study, which is a CDC, Centers for Disease Control, national study, representative, all regions, geographies, populations. And with this, I started drilled down a little into New Mexico and finding that we are in the top 5 states with Arizona, Mississippi, and Louisiana in food insecurity, highest rates. So a startling figure to me, I looked at in Centers for Disease Control in 2018, over 326,000 New Mexicans suffer from food insecurity. And when you look at the below the SNAP's Supplemental Nutrition Assistance Program, when you look at the poverty threshold, 74% of our adults in New Mexico fall below the poverty for SNAP, which is a federal poverty threshold. So it's a more of a salient issue, if you will, here in the borderland region where we have pretty high economic challenges and poverty rates.
And as far as the I'm sorry, go ahead.
Yeah, I think that the medical model of prescribing medication and therapy in this case won't help. Unless people are fed well, how would they get out of their chronic disease or be able to maintain the lifestyle that's needed with chronic diseases to maintain healthy diet?
Well, in the different studies, for the colorectal study, you used a sample of more than 30,000 adults
from NHANES,
20 years older across the nation, and for the kidney disease, it was 10,000 adult Americans with the disease. And how were those studies conducted?
So we used the data from the CDC, the National Health and Nutrition Examination Survey, from 1999 onwards. Then we linked these participants' health data with their mortality file from 2019 through the National Death Index, which is the CDC death files, to see how many of them survived with chronic disease, without chronic disease, with food insecurity, without food insecurity. So we conducted deep analyses on participants from 1999 onwards to see how much they survive by dividing them into various groups.
And were you surprised at all of what you found in each of the studies? Were you astounded?
Well, yeah, I think I was, with the high rate of death due to food insecurity alone and combined with chronic disease.
Right. And if you think about it, it takes a village, right? There's many factors that go into chronic disease, but oftentimes in the medical model, as you alluded to, it's treat the disease, the chronic disease process, and maybe not so much thinking about, does this person have adequate nutrition? How is that going to advance the progression of the disease to increase premature mortality? And so what I was surprised is, and the take-home lesson to me, I suppose, is that interprofessional teams need to wrap around care around the particular patient. So you need a registered dietitian, you need a nephrologist to look at the cancer, right? But there's also a whole team, social workers, everybody, nurses are all part of this interprofessional team to provide them optimal care. How often do doctors ask you for, if you went for with certain symptoms and you went to the office and said, I have these problems, do they ask you about how's your diet? Do you have adequate food? Do you have adequate access to food? The U.S. Department of Agriculture defines food insecurity as not only inaccessibility to nutritious food, but food deserts they talk about. And we are in one of those food deserts. What does that mean? It's cheaper to eat unhealthy, right? You could buy a hamburger, well, not 99 cents anymore at McDonald's, but you know, that is not good for you versus going to the grocery store and spending more money, and this is post-COVID too, it's really been more of a problem, for lettuce or leafy vegetables that you need to help boost your immune system to fight this disease. And so, you know, it's a whole systemic kind of thing. We need to think about other factors and have healthcare professionals really hone in on that.
Yeah, these two disorders that we picked on, I want to mention chronic kidney disease, you need to be having a very balanced diet. You cannot have too much sodium, potassium, protein. Same with colorectal cancer. It's near the stomach. You have to eat right to get into remission phase or have the right treatment outcome.
All right. Professors Jagdish Kubchandani and Karen Kopra-Fry, we thank you for joining us on In Focus.
Thank you for having us again.
And thank you for joining us on for another episode of In Focus. I'm Scott Mercado.
That's it for this week's program. Remember, you can always stay updated with news anytime at krwg.org. I'm Anthony Moreno. We'll see you next time on Newsmakers.